Hi, my name is Joanna and I'm here to do an examination of your cranial nerves. I'm going to start by washing my hands. First, I'm going to check cranial nerve number 1, which is the olfactory nerve. It is a sensory nerve and it mediates the sense of smell. I'm going to have you, first we're going to check the patency of your nostrils. So I'm going to have you cover one nostril and inhale. And then cover the other nostril. So the patency is okay, there's no obstructions. Now I'm going to have you check the smell of a scent. So first I'm going to have you again cover one nostril, and then I'm going to have you smell this. And can you tell me what it is?
Orange.
Excellent. And then I'm going to have you cover the other nostril, and then I'm going to have you smell this.
Cinnamon.
Yes, it's cinnamon. Oh, excellent. So she's able to differentiate between different smells. So that is the olfactory nerve. Now I'm going to do the cranial nerve number 2, which is the optic nerve. It is also a sensory nerve. And here we're going to check the central vision, the visual acuity. We're going to do the peripheral vision, and we're going to do a fundoscopy scope. A fundoscopy examination. So using this Snellen chart, which I have here, we're gonna check the visual acuity. So this chart says it's supposed to be about 6 feet apart. So I'm gonna have her cover one eye and read the smallest line you can read.
LTFFH.
Good. And then I'm going to have you cover the other eye and read the smallest line you can read.
LTFFM.
Good. So she actually just missed one on the 20/20 with the left eye. So she had 20/20 on the right eye and 20/20 -1 on the left eye. So that is the visual acuity. And then now I'm going to do the peripheral vision. In here, I'm going to have you... this is done by a confrontational visual field. I'm going to have you cover one eye, and then I'm going to put my hands, and you're going to tell me along this here how many fingers I am showing you. Okay, so just look up straight, look at my nose. Okay, tell me how many fingers I have.
2. 1. 2. 2.
Okay, great. So she has a full visual field on both eyes. And now I'm going to do the fundoscopy exam. So this is done with this. In here, we're going to check and look inside the eye. Turn it on first. And then I am going to do the right side first. So I'm going to have you turn a little bit this way, please. So with the right eye, I'm going to hold it with the right hand and look at her right eye. First, I'm going to look for the red reflex, and then once I find the reflex, I'm gonna go in and look at the back of her eye, and there I'm going to look for the disc is clearly marked as this is distinct. There's no swelling. I didn't see any. Let me try that again. Sorry. I didn't see any hemorrhages. Her retina is orange color. There's no increase in cupping. The venas are not tortuous, and her vessels are 2-to-1 ratio, which means that the veins are larger than the arteries. I'm going to look for the same things in this eye, and for this one I'm going to use again the left and left, which is going to be very hard. Cover my eye and find the red reflex. And then once I find the red reflex, I'm gonna go in. Again, I am gonna look for the pearly white disc. I'm sorry. I'm gonna make sure she has no swelling of the disc. That is distinct. There's no increase in cupping. and then she has an orangey color retina. There's no hemorrhage, and then she also has no venous tortuosity, which would indicate diabetic retinopathy. And her vessels are 2-to-1 ratio, which is the veins are larger than the artery. Okay, now we're gonna check the cranial nerves number 3, 4, and 6, which is the oculomotor, the trochlear, and the abducens. They're all motor nerves. The cranial nerve number 3 mediates the muscles of the eyes. Well, all of these cranial nerves mediates the muscles of the eyes. Cranial nerve number 3 mediates the size of the pupil, and as well as the levator function of the upper eyelid, and all of the eye muscles as well. And then cranial nerve number 4 is the trochlear, and that mediates the superior oblique of the muscles, of the eye muscles. And then cranial nerve number 6 is the abducens, which is mediates the lateral rectus masses. So in here we're gonna check the pupillary reflex with the light stimulus, consensual, and so I'm gonna shine a light through your eye, okay? So it'll be bright. I'm gonna do it on one eye first and then the other one. First is this eye. Oh, let's see, sorry, one more time. Excellent, so the reaction was brisk. Now I'm gonna do consensual. And then, so here I'm gonna check that the other pupil constricts as well when I do this one, which is great. Now I'm gonna check the other eye. Sorry, there's the light again. Good, so that is a good pupil. And then now I'm gonna check the consensual, meaning that this is gonna also constrict when I shine the light through this eye. Good, so they were both brisk and consensual. What else? Oh, then I'm gonna check your so this means that the pupils are perla, which is the pupils are equal, round, and reactive to light. And accommodation, I'm gonna check accommodation now. So first, for checking for accommodation, I'm gonna have her look far, and then I'm gonna have you look at my finger, and then I'm gonna get close. Great, so this means that the pupils are able to constrict, and then there's the movement bilateral. So she accommodates to, so she has accommodation. Her pupil size are about, let's see, so about a 4 millimeters right now. Yes, and so that it should be normal. Now I'm gonna do this extraocular movements. For this, I'm gonna have you look at my fingers straight up, and I'm gonna have you follow my fingers without moving your, just with your eyes, do not move your head, okay? So this is the 6 cardinal positions of gaze. And they're all symmetric, and she has full range of motion with her eyes. Now I'm going to do the corneal right reflex, and then here I'm going to shine a line through the bridge of her nose and check the symmetry light reflex of each pupil, which is symmetric. So she has a corneal light reflex that is symmetric as well. Now I'm going to have you do the cover eye test, and here I'm going to just check the misalignments or any muscle eye problems. So I'm going to have her just look up straight, and then I'm going to uncover her eyes and look for any abnormal eye movements or shaking, or her eyes need to stay fixed, which it is. Now I'm going to do the other eye, okay? Okay, and so she has a normal exam. Now I'm going to do the cranial nerve number 5, which is the trigeminal. And there's this a sensory and a motor nerve. This is a motor, which is the mastication. This is where we're going to show good strength of her mastication muscles. So I'm going to have you open your jaw and move side to side. She has great, well, she has no limitation on her range of motion, and she has very strong muscle movement in here. And then I'm going to do the central tract sensory, which is the central tract or the 3 tracts of the trigeminal, which is the forehead, the chin, and the cheeks. In here, I'm going to first have you tell me if the sensations are equal. Do you feel the same on both sides?
Yeah.
Yes. And then I'm going to do a sharp object. And then this is dull. It's a little bit, okay? So you're going to tell me if I'm doing it with the sharp or if I'm doing it with the dull, okay?
Dull. Sharp. Dull. Sharp.
And then,
Dull.
good. So she has a great sensory sensation is intact in the 3 trigeminal nerves. Now I'm going to do the cranial nerve number 7, and this is going to be the facial nerve. Again, this is also mixed. It's a sensory and motor nerve. In here, the sensory is the sense of taste, which is it mediates the sensory part of the anterior 2/3 of the tongue. We're not going to have her taste, but this is the sensory part of the facial nerve. And then the motor mediates the muscles of the face. And here I'm going to have her smile nice and big. Good. You can keep your mouth. You can close your mouth now. And I'm going to have you lift your eyebrows high. And then I'm going to have you puff your cheeks. Good. How about do your grinding? Excellent. So she has facial movements that are intact. They're bilateral and they're symmetric. Okay. And then I'm going to do the cranial 8 number 8. This is the vestibulocochlear sensory nerve. It's also this is only a sensory nerve. Here I'm going to check the hearing. First I'm going to start by whispering. I'm going to whisper some words on both sides and you're going to tell me what I say, okay? And this is going to check your hearing.
Soap. Line. Red.
Good. And then I'm going to do the other side.
Dog. White.
Nice. Sorry.
Desk.
Okay, good job. So that was the whisper and she did great. So she can hear on both sides. And then now I'm going to do the Weber test. So the Weber test, I'm going to put this right here in your head. You're going to tell me if you feel it only on one side or if you feel the vibration on both sides or only on one side, okay? So let me see.
I feel it on both sides.
Thank you. Okay, so the next test that I'm going to do is the Rhine test. In here, we're going to check for air conduction and versus the bone conduction. So I'm going to put this behind your ear in the mastoid bone, and then you're going to hear sound. You're going to tell me when you stop hearing the sound. And then I'm also going to do it on the side of your ear, okay? Same, you're going to hear sound. Just let me know when you stop hearing the sound, okay? And then I'm going to time that, so let me get my watch.
It stopped.
Okay, so now I'm just going to put it on the side of the ear.
It stopped.
Excellent. So that is normal. The air conduction should be twice as long as the bone conduction. So now I'm going to do it on the other ear. I'm going to have you turn just a little bit so we can see. Again, I'm going to put it behind your ear first towards the bone, and then you're going to tell me when you stop hearing the sound, okay? And then we're going to do it in the side of your ear.
It stopped.
Now we're going to do it right here.
It stopped.
Excellent. So, okay. Again, this is normal. The air conduction is lasts longer than the bone conduction. Now we're gonna go on to cranial nerve number 9 and 10, which is the glossopharyngeal and the vagus nerve. These are both mixed nerves. They're sensory and motor. So the glossopharyngeal nerve mediates the taste of the tongue and the posterior part. We're not gonna be doing this. I just wanted to let you know. And the vagus nerve It's the sensation along the vagus nerve so that is the sensation, the sensory, I'm sorry. And then the motor function of the posterior part of the tongue, of the mouth and the larynx. So first I'm gonna have you, let me grab my stuff here. I'm gonna have you open your mouth and say, stick your tongue out and say ah for loud. Let me see, let's do that again. Sorry. Let me have you open your mouth and say ah. Good. So in here I was able to check your uvula. It is, it rises to midline and there's no deviation. I'm gonna have you do that again, okay? And then I'm gonna stick the tongue depressor, so you might, hopefully you do. Stick your tongue out. Sorry, so she has the gag reflex and it's intact. Now I'm going to ask you to swallow. Okay, so that concludes the vagus nerve and the glossopharyngeal. They are both are intact. Now I'm going to do the cranial nerve number 11, which is the accessory nerve. This in here, this mediates the the trapezius and the sternocleidomastoid muscles of the neck. So in here, I'm going to have you shrug your shoulders, pretty resistance, good. She has a very strong resistance. And then I'm going to have you push against my hand, okay? And then we're going to do it on the other side. Good, that's excellent. So that means she's got a very strong resistance. That's a good reflex. And lastly, we're going to do the cranial nerve number 12 with this hypoglossal motor, and this mediates the movements of the tongue. So I'm going to have you stick your tongue out and then move it side to side. Excellent. I'm going to have you put the tongue against my cheek and then do it on the other side. Excellent. So this is a motor cranial nerve, and then her tongue is strong, so she has no tremors and she's able to move it side to side. And that concludes the cranial nerve examination.